finishing up where we left off, and we were just getting into the action potential. We were describing the ways that we can sum graded potentials in order to possibly get us closer to that threshold value, that membrane potential of -55. And so we described temporal summation as being the same stimulus. In other words, we can think about the same spot on the neuron. So if we have one neuron communicating to our postsynaptic neuron, the signals are sent in at that same exact spot. But because they're happening so close in time, right? Let's say one signal comes in at that spot, 2-3 seconds pass, another signal comes in. I can sum those two graded potentials together, and that may or may not get me closer to threshold, depending on the type of stimuli that they are. If they're both depolarizing stimuli, I can add them together, and that would potentially be a bigger value or a bigger membrane potential change. Spatial summation, on the other hand, is where we have different stimuli. In other words, different spots on that neuron. So let's say I have one stimulus coming in at spot W on that neuron. So one presynaptic neuron synapsing onto my postsynaptic neuron, and then a different presynaptic neuron synapsing at a different spot, right? Let's say it's Y. I can again sum those stimuli that are happening in the exact same time in different spaces, right? Spatial summation. And in this example at the bottom, it's showing you that one was a depolarizing event, one was a hyperpolarizing event. So summing those two actually does nothing, right? It just negates, or they both kind of just cancel each other out. And that actually doesn't get us any closer to threshold. So hyperpolarizing stimuli take us away from threshold, right? They're negative changes in the membrane potential, whereas depolarizing stimuli take us closer to threshold, and they are positive changes in that membrane potential. Okay, let's look at a checkpoint question here. Why are graded potentials unable to communicate over long distances? So given all that we said last time about the difference between a graded potential and an action potential, why are these not sustained over long distances?
Graded potentials only occur in the soma.
Okay.
And because they occur in the soma, they don't last very long.
Yep, exactly. So they only occur in the soma and they don't last very long. But the reason for that is because as we move away from that spot, that stimuli, it dissipates or it loses its intensity, okay? And so it just kind of gets watered down and never makes it to the axon hillock, which is the spot, excuse me, where the action potential threshold needs to be met. So if I'm making a stimulus at the soma and it isn't being sustained to make it to the axon hillock, because it's dissipating, it will not be sustained, okay? All right, excellent. So we're moving on now to objective number 2, which is the ionic basis of an action potential. We're describing the gating mechanisms for our voltage-gated sodium and potassium channels. And so we're going to somewhat build on the complexity of what we've been speaking about so far in terms of the cell. So we talked about the cell having the sodium-potassium pump, as well as the leak channels. But there are other channels on the membrane. These are called voltage-gated channels. And these can open and close depending on the membrane potential. And so we'll speak about those and how we can manipulate those and generate action potentials. So speaking about the membrane potential change, we know that the resting membrane potential is our reference point. In other words, our set point. If we're thinking about movements in terms of homeostasis here, -70 is our set point or our resting membrane potential. And so if we think about a depolarization or a depolarizing event, it's going to be a positive membrane potential change or an upstroke in terms of our graph here. Okay, and then we can also think about repolarizing events. Now, repolarizing events are downstrokes, but they're also moving toward our set point. And this is what differs in between a repolarizing event or repolarization and hyperpolarization. Repolarization is a negative membrane potential change that it's going toward set point or returning back to that set point, whereas hyperpolarization are going to be further negative membrane potential changes that are more negative than rest or more negative than our set point. Okay, and so on this basis, we have three different types of membrane potential change that'll help us describe what this action potential really is. Okay, so this is kind of what I was getting at a little earlier as we speak about the different types of channels that are on our neurons. So we spoke about ion channels, right? We spoke about there being different types of ion channels. And so far in this course, we've talked a lot about the leak channels, the ones that are always open, the ones that are found throughout the neuron for the most part, the ones that help to establish the resting membrane potential. What we have not spoken about are some of the other types of ion channels. We have ligand-gated channels, and ligand just means that something has to bind onto it in order for it to open or close. A ligand is any molecule that can bind onto a channel and manipulate its state. And then we have voltage-gated channels. And so voltage-gated channels are going to be sensitive to the voltage, sensitive to the membrane potential. So they're going to open in response to a membrane potential, and they're going to close in response to a membrane potential. Now, there are two types of voltage-gated channels. We have ones that are specific for sodium, and then ones that are specific for potassium. They're found mostly throughout the neuron, but sort of more concentrated along the axon, and even more so at the axon hillock, right? The axon hillock is the area where we really start the action potential. And as we'll see coming up here, the voltage-gated channels are responsible for initiating the action potential, and that would make sense that they're more concentrated at that axon hillock and more so throughout the length of the axon. We've also got calcium channels. These are found exclusively at the axon terminal, right? That bulb or swelling at the distal end of the neuron. And these are going to release neurotransmitters. And just to kind of make a full circle example here, these neurotransmitters can act as ligands. So these neurotransmitters can cross the synapse, bind to a ligand-gated channel, and initiate another action potential on another neuron. And so as we'll go on to see, this is what keeps communication flowing throughout our entire nervous system. One neuron is bringing in signals from another neuron, but it's projecting neurotransmitter, which can bind to other channels and start the process all over again, right? And so that's kind of the connection between the neurotransmitter released from the calcium channels at the axon terminal and the way that these neurotransmitters can act as ligands and bind to these ligand-gated channels. And these ligand-gated channels are only found on the proximal part of the neuron, so around the dendrites, along the soma or the cell body, and that would make sense. This is where we're going to, again, start that second stimulus that's coming into the neuron that can be propagated via an action potential and result in neurotransmitter release once again. Okay. All right, so looking a little closer here at the gating of the channels along the axon, membrane potential changes are usually controlled by the permeability of the neuron to these ions, to sodium and to potassium. And so we've been speaking about that before, right? The fact that the permeability is just a reflection of what channels are opened or closed. And so I can manipulate the voltage-gated channels, and I can therefore manipulate the membrane permeability to my ions. And as ions move in their relative directions, I can then manipulate the membrane potential, okay? Now, potassium has two types of channels. It's got the leak channels, which we spoke a lot about. And those are usually always open, they're not gated. And then we've also got the voltage-gated channels, which again are going to open at a specific membrane potential threshold. And then they will close when the membrane potential gets back to rest. And then we have sodium channels. They are There are also sodium leak channels, but as we talked about before, they're much fewer in number than potassium leak channels, okay? Although it's not mentioned here, I do want you to make a note of that. There are leak channels, but much fewer in number than we see potassium leak channels. And then we also have mainly voltage gated channels, okay? These are going to be closed at rest. And so the membrane is going to be less permeable to sodium, something we've already talked about, because of the very few leak channels that we see in comparison to leak potassium channels. And then they will open at a specific membrane potential threshold. So they're going to be voltage gated. And so at a specific voltage, they will open up and they will change the membrane permeability to sodium and allow sodium to rush into the cell, which is really the initiation of our action potential. Okay. So looking at the gating mechanism of our sodium channels first, and then we'll talk about the gating mechanism, which is quite different for our potassium channels. It's actually not as complex as what we see here for sodium channels. So these voltage gated sodium channels are open when the membrane potential depolarizes to -55. This is why that threshold value of -55 is what creates or initiates our action potential, because that is the membrane potential value at which our voltage gated channels are now open. This is called that threshold value that we talked about. And so what happens is that sodium rushes in due to its gradient. Remember, it has a really strong inward force because of a strong combined ECDF, right? It has an inward chemical driving force, inward electrical driving force. And so it's got a really strong inward ECDF. And then it's going to create the membrane potential change, which allows that to climb really high as it tries to approach the equilibrium potential for sodium. And as we spoke about before, the equilibrium potential for sodium is really positive, right? It's positive 60. And so that would reflect the movement of sodium once these channels open up. Sodium is going to try to rush into the cell in an attempt to approach that positive 60. It never actually gets to positive 60, and the reason why is because of, again, this voltage mechanism, this voltage gating. When these channels, when the membrane potential gets to positive 30, these channels are going to be deactivated. And so although sodium's movement is attempting to reach its equilibrium potential, it's going to start to get really positive, but it will never get to that positive 60 because positive 30 is the value at which these channels are then deactivated. Okay. What we'll say here now is basically how this gating occurs. So there are two gates on or associated with this voltage gated channel. There is an activation gate and then there's an inactivation gate. And so the activation gate is going to be voltage dependent. It's going to open at threshold and then it's going to depolarize. That is going to be a positive feedback event, okay? So it's only voltage dependent. So at -55, it'll open up and then it's going to cause more channels to open up and it's going to be a positive feedback change. So moving us further away from set point, further away from that -70 value as sodium rushes into the cell. And then the second gate associated with this channel is the inactivation gate. So the inactivation gate is actually voltage and time dependent. It is going to open at -55 as we talked about, but it's going to then close after a certain amount of time has passed. So because it's voltage and time sensitive, it's going to open at -55, but then it's going to close after 1 millisecond. And so that is going to create the opening during the depolarizing phase and then the closing, and that is going to initiate the second phase, which is the repolarization.